Thank you. I have to use my glasses. That shows that I've been doing this for way too long. Thanks for coming out today. In this election, we're playing for all the marbles. It's been 12 long years since Feed BC launched the battle to have our children's core health needs covered under Medicare. Now, we've lobbied hard at the provincial level, and we've sued all the way up to the Supreme Court of Canada. Now, along the way, we've had many successes. At least now, they recognize that autism is a health issue. That sounds obvious, but believe me, it's taken years to even get that concession. Due to our fight, and due to the court cases that we've won, and the backdoor lobbying, every child under 6 now receives $20,000 a year for treatment, and every child over 6 receives $6,000. Although this is not sufficient by any means, and it's not covered under our healthcare system, we have come very, very far from the dark ages, where children with autism receive no funding for treatment whatsoever. In fact, they even said that treatment didn't exist. Now, some in government even admit that effective treatment exists, and there are even programs with the name autism in them. Now, these gains were hard-won, and the battles were ferocious. Unfortunately, due to the spectacular wins in BC Supreme Court and the BC Court of Appeal, we inadvertently created a formidable enemy: health policy technocrats. Now, these are biased government-owned academics in Canada who saw that they were losing the battle to keep our kids out of Medicare because of the court cases. So they redoubled their efforts, and they introduced new biased evidence into the Supreme Court of Canada, arguing incorrectly that intensive behavioral treatment is novel, emergent, and experimental. In addition, every province in this country and the federal government joined the fight against us at the Supreme Court of Canada. Apparently, there's no enemy too big for us. We seem to attract them. So based on biased research, the Supreme Court of Canada washed their hands of our children. And in the process, they gutted the Charter of Rights and Freedoms and tossed the whole issue back into the laps of the lawmakers. Now, a side effect of these Canadian academics is that now American health insurance companies are using these Canadian bias reports to deny American children with autism treatment. And I'll tell you, that's one Canadian export that I'm not proud of. And that's why we're seeing one American state legislature after another passing laws mandating that children in the States with autism be covered by health insurers in the state. They're taking care of business. So after the Supreme Court of Canada told us this is not a legal issue, it's a political issue, we then tried the political approach at the federal level. And I just want to recap our efforts there. Since the judgment, we've had dozens of petitions tabled by MPs across the country asking the government to include our kids in Medicare. That's gone nowhere. Then we had a private member's bill, which would have legally introduced our children into the Medicare system. That was defeated by government. Then we had a private member's non-binding motion presented in Parliament to include our children in Medicare. And that passed over a year and a half ago. It's been thoroughly ignored, nothing's happened. Now, our advocacy also created an autism-specific inquiry in the Senate. The Pay Now or Pay Later Senate report recommended a national autism strategy to include our kids in Medicare with uniform national standards instead of the disastrous provincial patchwork that we have now. And guess what? It's been thoroughly ignored and nothing's happening. It has become abundantly clear that we need to get the attention and the cooperation of more politicians. We need to get the attention of these politicians, but we also need to educate them on the fact that listening to and believing government-owned academics is not going to be good for their political careers. There's got to be a competition of ideas in the Canadian health policy arena, and right now there's a monopoly of ideas, and that monopoly is keeping our kids out of Medicare. And as long as we don't have this competition, nothing will change. So, for every government report that says intensive behavioral treatment is experimental, we need a competing academic report that says it's best practice. So step one is to get the right politicians elected. We have a chance with the 2% solution to bring 14 politicians to the table. Once the election's over, though, then the work's only begun. Once those 14 politicians understand that the Medicare for Autism lobby is the reason they're in power, then we need them to form an autism caucus. It's our job to inoculate those politicians against the biased Canadian health policy gang, and that's the only way we're going to get our kids into Medicare. So we need to get those politicians to go to non-government academic politicians and tell them the truth, which is that intensive behavioral treatment is best practice for kids with autism. Now, over the years, many parents have come up to me and thanked me for bringing this system up to British Columbia because prior to 1996, nobody knew about intensive behavioral treatment. But now it's my turn to thank you, actually. As many of you know, 2 years ago, I made the transition of a full-time autism advocate and publisher to a full-time real estate professional. And I'd like to thank those in the autism community for all your referrals that contributed to my successful transition into a completely different field. I really do appreciate your support. I know that you appreciate mine, but I appreciate yours, so thank you very much. Now I'd like to introduce you to a young man who I know quite well, indirectly through his mother, who phoned me almost 7 years ago, frantic, saying that her son was just diagnosed with autism. She asked me about a science-based treatment that she'd heard about through Dr. Glenn Davies at a parent support group. This cautious but highly motivated mother wanted proof behind the treatment. So I recommended many resources, including the now famous New York report. She followed my suggestions, and 7 years later, I am privileged to introduce her son Wesley, who'd like to say a few words.